Hey guys, welcome back. Today we will discuss about anaphylaxis. Hope you know the meaning of anaphylaxis. Otherwise, we will discuss. What is anaphylaxis? Anaphylaxis is an acute hypersensitivity reaction that can be life-threatening. It is typically occurs suddenly and affect multiple body systems in a widespread allergic response. So anaphylaxis is allergic response. If untreated anaphylaxis can rapidly progress to respiratory failure and death. Common triggers include certain medications, specific foods, insect stings, and latex. Hyperacute reactions may also occur following immunotherapy injections designed to reduce overall allergic responses. When the cause of the reaction is unknown, it is referred to as idiopathic anaphylaxis. So, anaphylaxis is nothing but severe allergic response. And if untreated anaphylaxis can rapidly progress to respiratory failure and death. Anaphylaxis is triggered by hyperactive immune response. When the body is re-exposed to an antigen, mast cells and basophils release chemical mediators, leading to an exaggerated immune reaction. While symptoms often affect a single area of the body, in some cases the reaction can become widespread and life-threatening and resulting in anaphylaxis. Now we will see the signs and symptoms of anaphylaxis. The symptoms of anaphylaxis typically appear within 5 to 30 minutes of exposure and may include neurological symptoms such as headache, dizziness, paresthesia, and feeling of impending doom. In skin, pruritus, angioedema, erythema, and urticaria. In respiratory systems, that is important, hoarseness, coughing, wheezing, stridor, dyspnea, tachypnea, sensation of airway narrowing, and respiratory arrest. In cardiovascular system, you will feel hypotension, dysrhythmias, tachycardia, and cardiac arrest. Gastrointestinal system, you will get cramping, abdominal pain, nausea, vomiting, and diarrhea. So the symptoms vary from person to person. Not all the symptoms is visible in one person. It depends upon the body and immunity and level of health, etc. Anaphylaxis can usually be diagnosed through physical examination. So laboratory test or other diagnostic procedures are typically unnecessary. So we are discussing nursing care plans. So what is nursing process for anaphylaxis? Anaphylaxis requires immediate recognition and intervention as it can rapidly progress to respiratory or cardiac arrest and death. Early stage management is crucial and it includes removing the trigger whenever possible, administering epinephrine promptly, and airway management to ensure adequate oxygen. Also, patient education is essential, including proper use of an epinephrine autoinjector, referral to an allergist or immunologist is recommended to identify specific triggers and prevent future episodes and potentially through short-term desensitization therapy. So removing the trigger, administering epinephrine injection, and airway management. So nursing process will focus on these three aspects. And we can create nursing care plan on decreased cardiac output, knowledge deficit, impaired spontaneous ventilation, ineffective airway clearance, and risk for adverse reaction. First one is decreased cardiac output related to vasodilation or hypovolemia or dysrhythmia and secondary to anaphylaxis. So our nursing diagnosis is decreased cardiac output related to vasodilation, hypovolemia, dysrhythmia, secondary to anaphylaxis. We have to write the subjective and objective data. Subjective data means what subject is saying about the condition, that means patient. Objective data means what you have observed from the situation of the patient. Here, subjective data is the patient says that I feel faint, dizzy, and my heart is racing. So they don't use any terminologies. However, they are saying, whatever they are saying, you have to write like that. Then objective data. That means what you have observed. Objective data In objective data, you can include hypotension, tachycardia, dysrhythmia, decreased peripheral pulses. So what you have observed or what you have seen in the case sheet, that you have to write under objective data. So again, in next column, you have to write diagnosis, decreased cardiac output related to vasodilation or hypovolemia or dysarrhythmia secondary to anaphylaxis. And the goal will be, it will be in future tense, the patient will maintain adequate cardiac output as evidenced by stable vital signs, warm skin, and adequate urine output. If they have adequate cardiac output, definitely the vitals will be normal. They will show a normal skin temperature, warm skin, and adequate urine output. When it comes to the planning, that's the third section. Planning, monitor vital signs such as blood pressure, heart rate, respiratory rate, and oxygen saturation frequently. Rationale, to detect early signs of cardiovascular collapse. In implementation, in past tense, you have to write because already I've done. I mean, after completing the task only, you have to write the implementation. Monitored vital signs such as BP, heart rate, respiratory rate, and oxygen saturation. Second planning, administer epinephrine as prescribed because it is a first-line drug to reverse vasodilation and also to increase cardiac output. Then in implementation, you can write administered epinephrine as prescribed. Next planning, place patient supine with legs elevated if tolerated to promote venous return and improves blood pressure. Placed patient supine with legs elevated. That is implementation. Then next planning, establish and maintain IV access. Rationale for rapid administration of fluid and emergency medication. Implementation, established and maintained IV access. And the evaluation will be the patient maintained adequate cardiac output as evidenced by stable vital signs, warm skin, and adequate urine output. So while writing your evaluation, always check the goal. Then also administer oxygen to optimize oxygen delivery to tissues. Administered oxygen, that should be the implementation. Prepare for advanced cardiac life support, that is ACLS, if cardiac arrest occurs. For what? To save life, that is the rationale. In implementation, prepared for advanced cardiac life support, ACLS, if cardiac arrest occurs. Second diagnosis is deficit knowledge or knowledge deficit. Subjective data, the patient says that I don't know what caused this reaction or I don't know how to use EpiPen or epinephrine. Objective data, patient asks frequent questions about the episodes and improper demonstration of auto-injector use, that is EpiPen. Then diagnosis, knowledge deficit related to lack of information about anaphylaxis, management, and epinephrine auto-injector use. Goal, the patient will verbalize understanding of anaphylaxis, triggers, early signs, and correct use of epinephrine auto-injector before discharge. When it comes to the planning, assess patient's baseline knowledge to identify gaps and tailors education. Assess the patient's baseline knowledge. Educate on allergen avoidance to prevent recurrence of anaphylaxis. In implementation, educated on allergen avoidance. Next, planning, teach step-by-step use of epinephrine auto-injector. Rationale, to empower the patient for immediate self-care. Implementation, taught step-by-step use of epinephrine auto-injector. And the goal, the patient verbalized understanding of anaphylaxis triggers, early signs, and correct use of epinephrine auto-injector before discharge or during the day of discharge. That also you can write. Also, you can add these plannings also. Provide written instruction and demonstration practice. Rationale, to enforce learning and skill retention. Implementation, provided written instruction and demonstration practice. Next, planning, encourage follow-up with allergist or immunologist. Rationale, for further evaluation and long-term, to further evaluation or for further evaluation and long-term management. Encouraged follow-up with allergist and immunologist. Next diagnosis, impaired spontaneous ventilation related to airway edema, bronchospasm, and increased work of breathing. Subjective data, the patient says that I can't breathe, my throat feels tight. Objective data, dyspnea, stridor, wheezing, and use of accessory muscles, tachypnea, low oxygen saturation, restlessness, and anxiety. Whatever you have observed, that you have to write under objective data. The diagnosis, again, I am repeating, impaired spontaneous ventilation related to airway edema or bronchospasm or increased work of breathing. The goal, the patient will maintain effective ventilation as evidenced by normal oxygen saturation. Planning, assess respiratory status frequently to detect worsening airway compromise. Implementation, assess respiratory status frequently. Explaining, administer epinephrine promptly. Rationale, to reverse airway edema and bronchospasm. Implementation, administered epinephrine promptly. Explaining, provide supplemental oxygen. Rationale, to prevent hypoxemia. Implementation, provided supplemental oxygen. Next planning, prepare for advanced airway support like intubation or tracheostomy to maintain ventilation if obstruction progresses. Implementation, prepared for advanced airway support. Next planning, administer bronchodilators or antihistamines as prescribed by the doctor. Rationale, to relieve bronchospasm and allergic response. Implementation, administered bronchodilators and antihistamines as per the doctor's order. And the evaluation will be the patient maintained effective ventilation as evidenced by normal oxygen saturation, reduced respiratory effort, and absence of wheezing and stridor. Next diagnosis, ineffective airway clearance. Subjective data, I feel like my throat is closing. So the patient complains that I feel like my throat is closing or I can't clear my throat. Objective data, hoarseness, stridor, wheezing, coughing, drooling, or use of accessory muscles, cyanosis, etc. So the nursing diagnosis is ineffective airway clearance related to increased secretions or laryngeal edema or bronchospasm. So whatever you have observed, that you have to write. That's what I'm just telling, like or if you observed everything, you can write increased secretion, laryngeal edema, and bronchospasm. If you found only one, only that specific thing you have to write. Goal, the patient will maintain a patient airway as evidenced by effective cough, clear lung sounds, and normal oxygen saturation. The planning is position the patient upright, if conscious only. For what? To optimize airway expansion. Implementation, position the patient upright if conscious only. Next planning, administer epinephrine and nebulized bronchodilators as clearance. Rationale, to reduce the airway edema and improves the breathing. Implementation, administered epinephrine and nebulized bronchodilators as prescribed. Next, suction secretions are needed to prevent obstruction from mucus. So provide suction secretion process. Suction secretions are provided to prevent the obstruction from the mucus. Then prepare for emergency airway management to ensure readiness in case of complete obstruction. Prepared for emergency airway. Next planning, monitor for signs of airway obstruction progression. Rationale, to early intervention prevents respiratory arrest. Implementation, monitored for signs of airway obstruction progression. And the goal will be the patient maintain the patient airway as evidenced by effective cough, clear lung sounds, and normal saturation. Next diagnosis is risk for adverse reaction related to hypersensitivity to allergens, previous history of anaphylaxis. Subjective data, the patient expresses fear of another attack. And also the patient said, I don't know what else might trigger. Objective data, history of allergies, anxiety, and hypervigilance. The goal, the patient will remain free of recurrent anaphylactic episodes by identifying triggers and adhering to preventive strategies. Planning, identify and you have to identify and document allergens clearly in medical record. Rationale to prevent future accidental exposure. Implementation identified and documented allergens clearly in medical record. Teach avoidance strategies such as food, environmental allergens, and drugs to reduce the risk of re exposure. Implementation taught avoidance strategies. Next, planning encourage carrying emergency medications like EpiPen and antihistamines to provide immediate interventions if exposed. Implementation encouraged carrying emergency medication. Provide allergy identification to alert others in emergencies like bracelets, cards, or mobile app. Provided allergy identification like bracelets, or they can hang, or they can hold, or it will be in mobile means automatically the alarm will go. I mean, the alert will go to the specific responsible, immediate relative. Then refer for allergy testing and desensitization therapy to reduce long-term risk of severe reactions. Referred for allergy testing and desensitization therapy. And the goal will be the patient remains free of recurrent anaphylactic episodes by identifying triggers and adhering to preventive strategies. So these are all the nursing diagnosis and care plan for anaphylaxis. All right. So these nursing diagnoses are very, very important. So hope you understand what is anaphylaxis. So thank you guys. So guys, so these are all the signs and symptoms of anaphylaxis. Okay, so the nursing diagnosis and process will focus on removing the trigger, administering epinephrine and airway management. And we have created nursing care plan on decreased cardiac output, deficit knowledge, impaired spontaneous ventilation, ineffective airway clearance, and risk for adverse reaction. Okay, so the nursing diagnosis for decreased cardiac output related to vasodilation, hypovolemia, dysrhythmia, secondary to anaphylaxis. Okay. Second one, deficit knowledge or knowledge deficit, you can write, related to lack of information about anaphylaxis management and use of epinephrine. That is the first line safe drug for this allergic reaction. Then, impaired spontaneous ventilation related to airway edema, bronchospasm or increased work of breathing. Okay. Then next one, ineffective airway clearance related to increased secretions, laryngeal edema and bronchospasm. Then next one, risk for adverse reaction related to hypersensitivity to allergens, previous history of anaphylaxis. Okay. So these are all the nursing diagnosis and care plan for anaphylaxis. So hope you understand what is anaphylaxis. Okay. So while saying simply we will say allergy, but if we untreated allergies, severe allergies can lead to even death. So it is very, very important to give proper treatment. Here you can see an image. So this is an example of anaphylaxis. If you get anaphylaxis, okay, if you are having anaphylaxis, your face or body will be like this. It's simply, we will say allergy. And again, I would like to say, if untreated, anaphylaxis can rapidly progress to respiratory failure and death. So these are all the signs and symptoms, like headache sometimes will come, pruritus, like pus formation in the skin, okay, and abnormal, the coughing, breathing pattern will change. Hypertension, normally for almost this all kind of disease, hypertension will come. In this case, hypertension will come. That means the BP will go down. All right, guys. So this is about anaphylaxis. Hope you understand and learn the nursing diagnosis and care plan, guys. Next time, another nursing diagnosis and care plan.